Hey, it's Dr. Scott from Chiropractic Associates in Long Grove, Illinois, and this month, October, is Spinal Health Month in the state of Illinois. So we're talking a little bit about your spine and the importance of taking care of your spine and maybe some things that you didn't understand or didn't know about your spine and its connections to your health. So last week we talked about the cervical spine and what was happening in the cervical spine. This week we're talking about the thoracic spine, and this is kind of if you're looking at somebody from the back with their shoulder blades on either side, but you've got 12 vertebra in your thoracic spine, and then ribs are attached to those vertebrae, so they make a unique joint, the costotransverse joints, where the ribs attach to the vertebra and comprise your rib cage. And of course, within that rib cage is protected all of your internal organs, heart and lungs, and a little further down, organs of the abdomen. And so allow the nerves of the thoracic spine control your internal organs, but they also control the autonomic nervous system. That can have a lot to do with stress response. And so people who have problems in their thoracic spine can sometimes have a problem with stress response. They might feel anxious, they might feel stressed, they might have a hard time dealing with those challenges in their life. And you also need to understand a concept called visceral somatic reflexes. Sometimes organ systems within our body can be sick or ill, maybe struggling, and they will transfer or reflexively send pain to the somatic system, which might cause pain, basically pain in the muscles, pain in the joints of the thoracic spine. And conversely, sometimes problems in the muscles, bones, and joints of the thoracic spine can maybe be problematic for the visceral or the organ function, what we call a somatic visceral reflex. So this connection between the nerves of the thoracic spine and your internal organs and your general health is a very important one. For instance, generally speaking, in the upper part of the thoracic spine controls heart and lungs, also your immune system in that area. Kind of a little bit further down in the mid-back, that's where we start getting into the stomach and the gallbladder and the small intestine, digestion, a little further down into the kidneys, and then a little further down from there, some of the large intestine, the colon, and then areas like uterus and females. So common problems of the thoracic spine are often postural. Maybe we're just not carrying very good posture, so that can create aches and pains. Sometimes pain in the thoracic spine actually comes from the neck. That's an important one that you shouldn't miss. The problem in your upper back might not be in your upper back. It might actually be coming from your neck. That's why a thorough exam is important. Rib strains and sprains, that's a common one among our athletes, dancers, hockey players that we see in the practice. Referred pain from the neck, cervical spine, as I mentioned. Immune function, very important to consider immune function when we're looking at thoracic spine issues. Scoliosis is a common problem that we see, although interestingly, it doesn't create a lot of pain often, but it's something we want to keep an eye on because of this very unique and important connection between internal organs and what's happening with nerves of the thoracic spine. Compression fractures, we'll sometimes see that as well. People fall down, they compress these areas of their spine, fracture the bones, and a lot of those internal medicine issues because of the connection of the nerve tissues and those nerves and their response to where they are in our thoracic spine. So if you'd like to know some more about what's happening in your thoracic spine, maybe you've got some questions or concerns about conditions in your life and pain within these areas, give us a try over at Chiropractic Associates in Long Grove, Illinois. I'm Dr. Scott, and we'd be happy to help you this October for Spinal Health Month.